What I would say is, in the state of Oklahoma, we have a real coordination problem, I think. If I were to zoom out to 10,000 feet, I mean, one, we're looking at the same things we always do, which is quality, access, resources. The care is there. All the pieces are there. It's just we have to put them together in a way that makes sense, not just for the people who need the care, but everybody else, whose taxes and resources go into making sure that, we maintain, our societal fabric and, we take care of the people who need help, but also help them learn to help themselves. What I would say is, in the state of Oklahoma, we have a real coordination problem, I think, and we don't know how to put all the pieces together in a way that makes sense for everyone. And I think everyone should care, even if you have never been touched by addiction or mental health issues. And, why should you care? Well, if you have to, step over syringes to get into your favorite Starbucks or, Sprouts, the quality of your life is significantly degraded. And you would wonder why somebody wasn't helping the folks that appeared in your neighborhood. It's important to recognize that if we don't take care of people in the behavioral health care space, that the knock-on effects of that are going to be significant for and not only that, for the social contract, for the stability of our infrastructure. I won't get into, all the ways that we see those domino effects happen, but there's plenty of examples across the country where if we don't do something about this, it just tends to have an impact on everything else that we care about. Navigating the healthcare system in general is a nightmare, and I don't mean to be hyperbolic, but how do we know what good care is? How do we find care? And, as we talked about, it's not sufficient for someone to hand you a list of places and you have no idea what any of this is. And so I do think we need to resource some type of ability to help people access those services. But, there's hope, and it's available here in the state, and it's normal to be scared. And, the fact that anyone is willing to reach out for help, that's all I ask, and we'll take care of the rest. I would say, something like 90-something% of people search for treatment or care on a digital or handheld device, and that's even more confusing for them. And we live in a digital age where, it's really hard to, back in the old days, you had a problem, you just went to your local hospital or doctor's office, and now there's so many different choices. Who's a bad actor, who's not? Am I going to get the care I need? Am I not? But don't hesitate to reach out and talk to someone. And if you're not ready for the care yet, but you just want to ask some questions and, you're getting ready to get ready, maybe, reach out. I mean, and there's no wrong door, as we say in the state. Talk to your healthcare provider, talk to your teacher, your counselor. You happen to know somebody that you work with. Just don't hesitate, because you're going to find your way, but you have to speak up, and you have to take the step of calling and reaching out. Email, call, do whatever you can do, and understand that, there's nothing to be ashamed of. There's nothing to feel badly about. It's just another health issue like any other health issue. And I can't imagine someone who breaks their leg being fearful of calling for some help. And again, it's hard to understand why any other issue like this is different, but it is. But again, just think about it that way. If you had any other medical concern, if your leg's falling off, you're gonna make a phone call. And if you're not doing well, emotionally and psychologically and spiritually, treat it like the same thing.